Hello, everyone, and welcome to the Happiness Journey with Dr. Den podcast, where every journey is worth living. My name is Dr. Den, and I'm your host for today's episode. I'm a bilingual neurolinguistic programming and cognitive behavior psychotherapist specializing in anger management issues, both court-appointed and private, marriage counseling using the EFT method, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one sessions in both French or English, and also do group settings. If you need any assistance, reach out to DMV Therapy and Coaching Services at 301-325-1550, and our website can be found at lifecoachdanamzalai.com. Today, I'm very excited to have for our 8th episode of season 18, a very special guest, and nurse practitioner, as well as medical intuitive and energy whisperer, Dr. Dolores Fazzino. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Dolores, the floor is yours.
Well, thanks, Dr. Dan. I solely appreciate the opportunity to talk to your audience. And I'm going to introduce myself. I'm Dr. Dolores Fazzino. I'm a nurse practitioner, medical intuitive, and energy whisperer. I've been in the healthcare industry for well over 45 years. And I bridge the spiritual with the physical and the invisible with the visible. And I work one-on-one with patients, working through any type of lifetime challenges that they may encounter, because we all kind of hit our wall every so often and reach that point where what's next? And you really don't know. You don't have a reference point. So I help people maneuver through that. As well as, a little part of my career is I've been in the surgery realm for the last 36 years as an independent contractor, self-employed assistant in surgery. And so I've assisted on over 20,000 surgical procedures. So I get to see what happens behind the scenes. And what I mean behind the scenes, more in the quantum field versus what we could see physically when I'm in a surgical arena. So there's more happening behind the scenes that a lot of people aren't privy to, but I am. And so I assist people in that dimension with their health and wellness as well. I also help people who are maneuvering through chronic diseases, say if they have a cancer or they are going through surgery for some procedure, because surgery is the tip of the iceberg of what really happens. Underneath the iceberg is all our thoughts, beliefs, whether or not we dealt with our emotions, any type of stressors that we've had, whether or not we're connected to our higher self. And all that kind of comes into play before a physical thing is created, believe it or not. So a lot of times in our physical world, and what I found in Western medicine, they're very good at looking at the physical, but they don't address the underlying issues that created the problem. And that's where I step in, and with my gifts and talents, I'm able to guide people into the directions that they need to go to so they could have true health and lasting wellness. Too often, when we cut something out in surgery,
Mhm.
you know what? Sometimes there's a recurrence, like, a year, 2 years, 3 years later. And sometimes it's because we never looked at what was really going on underneath the hood, so to say. Because, that is what drives everything. And, cutting something out doesn't make it go away because everything's energy.
Correct.
And the lingering things that created that just find another place to create something else because it hasn't been addressed. So, long story short, that's what I do. Those are my gifts and my talents. And I like to help people heal in ways they never thought possible, because our world, there's so much going on right now. And we're going through massive paradigm shifts in every arena you could imagine. Healthcare, particularly, because, and that's my little niche, but every place else in the world, everything's going, you know, it's almost disintegrating so it could rise from the ashes and create something different. So I find that we're in very exciting times, even though it looks very chaotic on the outside. This is a good thing, because out of that, amazing things are going to happen as we progress into the future.
Beautiful. Well, thank you so much for being here, Doctor. And I think we're going to jump directly into the format of question and answer and figuring out, first of all, when it comes to interacting with patients, especially post-surgery. We all know that doctors have what we call no bedside manner, especially when they divulge the diagnosis, etc. Do you come into the interaction with the patient in terms of like calming them down prior to the surgery and making them feel comfortable? Or what exactly, as a nurse practitioner, was that most of your job beside being in the room, in the operating room, but helping them cope with the risk of them not making it through?
Well, that's an interesting question because I really had not done a lot of pre-op or post-op. I was just in the surgery arena as the assistant surgeon. So, but through my entrepreneurial tendencies, I saw a need for something that wasn't being addressed, and that's where I've kind of established my one-on-one coaching for those people. And you know what? It's not for everybody because it's people who are awake enough to realize that there's more going on, and maybe they've had a wake up call, and what they had been doing had been working up to that point, and now it's not. And this is, those are the people that I usually seem to draw that are ready to make some changes and do some shifting and look at things from a different perspective than what we've been trained Western medicine wise.
Now, in your 45 years experience, I'm sure that being in the operating room, you have seen everything. And I'm sure that a lot of them were mistakes that were trying to be shoved under the rug, etc. Do you feel that doctors or surgeon are taking responsibility for their action, especially in this industry? Or do you feel they just try to get the hospital to protect them if anything sweet?
Well, you know what? Every industry has their outliers, okay, where there's issues, and healthcare is not any different. I've been very blessed and fortunate that many of the people that I surround myself with, that I work with, because I could choose pretty much, I align with the people that I'm aligned with. So usually, the people that I work with or have been drawn to me are of a higher caliber, where I haven't really, they take ownership and responsibility, and they're very, very good at what they do.
Okay.
I feel very safe and grounded when I'm working with the majority of them, and that reflects over energetically to the patient and the patient well-being in that OR suite. Because remember, everything's energy. Who
Yes.
you are, you show up everywhere you go, here you are. So if you are um, have good integrity, good morals, good values, good energy, so to say, that goes with you. And no words have to be said sometimes, but it's a ripple effect. Patients feel that. There could be a language barrier, but it's a feel thing. And you know that because you speak several languages, and it's just like it's all feel. You could tell what's going on with somebody without sharing the language. It's the energy and the feel. So, yeah.
Well, now you're talking about energy, and this is something that I was always very passionate about, especially in cases of NDE, near-death experiences and all. Do you feel that consciousness after a certain period of time, let's say someone physically passes away on the table, and then they
Yeah.
come back, do you feel that there's a time frame? Because I'm not sure exactly how long. I mean, they say that more than 10 minutes, if the brain doesn't have oxygen, they become vegetable. So have you experienced people sharing with you that specific moment that they faced when they were in a near death experience?
That's an interesting thing too, because I know indirectly I've heard things. I haven't experienced it directly with clients. And you're absolutely right. There's scientific proof that, if you're, without circulation or, a heartbeat or whatever for, at least 10 minutes. But I mean, strange things happen all the time. I think that, we look at things in our earth realm as black and white, but there's all these shades of gray all the time. So you can't make a judgment call on that because, there are times maybe that people, we resuscitate them for, a long period of time and they wake up and they're okay. So, you just don't know because I think there's kind of more going on. First of all, I'm going to step out of the Western medicine thing and go into more of the spiritual thing. It's just like if a person's time is up, it's up, If it's, and maybe their time isn't up and they need to come back to do more work or their mission isn't complete. So whatever that is, we aren't privy to that. That's just between that individual and their higher essence and God spark or whoever you believe in, if you believe in anything. So I mean, there's more mystery there than congruent and concrete black and white things. And I think we, as time evolves, we'll probably be privy to more and more of that because we're raising our frequency and vibration and higher vibrative states can tap and access that information more so than lower vibrating states, so.
Nurse practitioner or even as a surgeon, Dolores, do you feel that being in a hospital environment, there's a lot of like ethics involved when it comes to patients signing DNR, and at the same time, if they were not mentally able to make a decision of that sort, how or where does a doctor falls in when it comes to respecting the do not resuscitate versus, oh no, they had some mental illness, we should not listen to them and we should resuscitate them after they passes away?
Gosh darn it, that's a tough question, Dan. I really don't have I don't have a reference point for that. So I honestly can't answer that for you. I know that usually a DNR is like a legally binding thing, with the exception if they go into surgery for something that is, curable. I
Oh,
know there's that thread of that as well. So just for an example, like a person breaks their hip and goes in for a total hip or something like that, but they have a DNR thing. Usually, I think they will fix the hip, because it's, that, but, if anything, was there complications because of that? I'm not really sure how that would be addressed because I'm not really involved with that at all. So that's my honest answer.
okay. Well, that's honest enough. I mean, obviously, there's a lot of intricacies behind all of that, and
Oh my God, yeah. It's just like it's never black and white. There's so
ever,
many shades of gray, and I think if we look at life in particular, that there's all these possibilities, there's infinite possibilities. So, it's just something that, you just have to um, take a step within yourself and feel what's aligned. It's like trusting your instincts on that and your inner wisdom.
but
Because, yeah, and you and I probably agree on this. It all comes down to that.
right. So,
Trust your gut, they say. Right?
do you think, as in a pre-op environment, do they train the nurses to be able to be therapists, to be able to kind of like help the patient and calm them down or discuss
Oh,
about?
absolutely. Absolutely. That's part of like, being a nurse and stuff like that. And, just, having that compassion and being able to lean in and listen and making sure that your patient's, being heard. And, what that's like when any conversation was like when a person is fully present,
Mhm.
do pre-op intake, the nurses who prepare patients for surgery. Yeah,
Okay.
yeah. So I believe, I know that the nurses like prepare patients for surgery because they have pre-op appointments and they kind of go over everything and explain everything. And sometimes this is where, you could gather some extra data, from, the nurse's intuitive wisdom, basically, what's happening and what's going on. And, that's just part of the way nurses are trained. They're supposed to gather information and be compassionate and empathetic and
Yeah, I guess there's some bad connection with the internet here, so I'm not sure exactly what is going on either on your side or my side. But yeah, so my question to you, Dolores, do you feel like because of
I think we froze up again.
yes, I think we did freeze up. I don't know exactly if it's on my side or your side, but
Uh,
I think they get
yeah.
most of it. But here's my question. You mentioned about being compassionate, but do you feel as well that being compassionate also create some sort of attachment with the patient? And then if anything happens, either they being diagnosed with stage 4 cancer, whatever it is, or even passes away, the nurse will feel all the impact with patient after patient and all that can really take a toll in their psyche.
Oh, absolutely. But you know what? That's part of being human.
Mhm.
Why, I look at it from this perspective. That's a part of who I am. And why would I want to compartmentalize that?
True.
I feel that it's important to be authentic and genuine. And if I'm going to feel that and experience that, by all means, yes. But the other thing I want to add to that too is that, a lot of times we get triggered by things. Okay. And taking that a step further, we get triggered, but instead of reacting and trying to control it and playing whack-a-mole at the fair with the things, things popping up, it's just like I invite people to step back and just take a deep breath and just ask, why am I being triggered? What is it bringing up in me? Because that tip of the iceberg is something way deeper that's in there, and it's probably a matrix of how to get down there because the two things don't look like related. And I'm going to share something with you that happened to me recently. I lost a colleague about a month ago to suicide. And I wasn't close to him. I really didn't know him. I knew of him, but that just hit me to my core. In fact, I was heartbroken and I couldn't understand why that was so until I really sat with it and I went a little deeper. And it brought me flashbacks to a time when I was 4, and that was over 60 years ago. Okay. That my father was going through my great grandmother, his grandmother passed away. And he said he was holding me and he said, little Nani passed away. And I started bawling like a baby. And I didn't know at the time that he just couldn't handle me crying. So he basically said, "You got to stop crying." And he said, "Are you going to cry when I die?" I mean, who says that to a 4-year-old kid? Well, I took that on as something that has been running my life for 60 years. And I finally got to witness it as an adult going back there, that I could see how disturbed my father was because he was in his grief, that he was probably going to lose it if I started crying.
Oh, okay. And then,
Okay.
but the
So
thing,
what I'm saying is that I was able to heal something for myself because I partially grieved that incident. I finally got to go back 60 years later and grieve fully.
but how did it resurface after 60 years, Dolores? I mean, did you
What's
hold,
that?
how did it resurface after 60 years? I
It
mean,
resurfaced because when I sat with what I was feeling with what had happened, I got flashbacks from that time in
oh,
my mind. So I knew there was something I had to go there and look at. But this is what I'm saying is that people don't understand or realize the gifts of every situation that you're in. It's not about keeping it professional and putting it in a nice little box and package and put it on the shelf. Guess what, folks? It's energy. It's all interconnected. If there's healing that needs to happen for a person individually, that might be you, the practitioner. I invite you to go there and look at it because it will really, heal something very deep. And it's a ripple effect that's timeless. It goes through, dimensions, timelines, whatever, and it allows people to heal. So you could show up better for the next person that comes into your space.
and that person in particular, even though you were not close to them, you still felt the full impact.
Oh my God. Yeah, I felt it. I was heartbroken, heartbroken, you
Wow.
know. So the thing is like, look how you're responding to something because there was, that was I call it hidden grief because it was hidden for 60 years. I mean, what can I say? It was very liberating and very healing.
So what, okay, so I'm sure that a lot of our listeners are asking the question, what is an energy whisperer? I know we have
And
dog whisperer, we have
yeah, energy whisper. If energy was a foreign language, I'm very fluent in reading it. Be it be it because energy's waves. Our physicality is a very dense form of energy, but and our thoughts, beliefs, our emotions, whether or not they're trapped or not, are just wavelengths.
Mhm.
Those are the things we can't, some people can't tangibly see. I can. It's a feel thing for me. So it's just like I feel how I read energy as if if it's my primary language. That's, yeah.
So
So
what caused that? When did you know that you had that gift to be able to read? I mean, reading energy, is it reading people's personality at the same time?
it's just intuitively reading them. It's just, connecting with the wavelength and, and the energy, because it's all energy. You could tap into a plant in the room and know what that plant is kind of experiencing, seriously, or you tap into an animal, you kind of know what's kind of happening. I mean, that's what it's like for me. And yes, I've been able to do that ever since I was a child. So I kind of came into this world that way, wired a little differently.
So do you feel that because of that gift, you were able to go into the medical field, or that was completely different and you just
Oh, it was completely different because I was on um, a career trajectory to become a concert clarinetist. And in the 11th hour, I changed my field of study after I witnessed my father's miraculous healing from a chronic health condition that he had for almost 10 years with an alternative practitioner. So, long story short, I grew up in a household where we weren't allowed to feel. And so when you say that to somebody who's an empath, intuitive, and highly sensitive person, my mom's MO was ignore it, it'll go away. Guess what? When you ignore it, when you're like me, it gets bigger because it wants your attention. So I channel all my energy and my emotion into music.
oh,
And with that, I really excelled at that because, not being able to feel is, it wasn't how I was wired. So, long story short, my dad had back surgery in the 1960s and ended up getting a hospital acquired infection, which back in the 1960s was pretty much a death sentence because they didn't have the technology or the antibiotics or the medications to help that. And all the product, the protocols and stuff like that they do. And my dad, was really sick. Every time his immune system got compromised, he was deadly sick in the hospital for 2 months at a time. And, this happened almost on an annual basis. And then by 1975, the CAT scanner got introduced to modern medicine, the first actually real piece of diagnostic technology. And when they put my father underneath the machine, they saw where his issue was coming from, and it was where he had his previous back surgery. And